What are the alternatives to CPAP for COPD and sleep apnea? If you or someone you know is dealing with chronic obstructive pulmonary disease and sleep apnea, you might be curious about alternatives to continuous positive airway pressure therapy. Let's break down some options that could work better for you. First up is Bilevel Positive Airway Pressure therapy. This method uses two different pressure levels. You get a higher pressure when you inhale and a lower one when you exhale. This can be easier for people with both conditions because it reduces the effort needed to breathe out. Many find this option more comfortable than continuous positive airway pressure. Next, we have auto-adjusting positive airway pressure machines. These devices automatically change the pressure as you breathe throughout the night. This means you get a more personalized experience. However, it is not as commonly used for patients with chronic obstructive pulmonary disease compared to Bilevel Positive Airway Pressure. Another option is Expiratory Positive Airway Pressure devices. These are small valves that sit over your nostrils. They create pressure when you exhale to keep your airway open without needing a machine. This method may work better for mild to moderate obstructive sleep apnea, but it might not be ideal for those with chronic obstructive pulmonary disease. Oral appliance therapy is also worth mentioning. These custom-fitted devices reposition your jaw or tongue to keep your airway open while you sleep. They are often recommended for mild to moderate obstructive sleep apnea. However, they do not address the specific breathing challenges that come with chronic obstructive pulmonary disease. Positional therapy is another approach. If your sleep apnea worsens when you lie on your back, this method encourages you to sleep on your side. While this is a non-invasive option, it may not be effective for everyone, especially those with chronic obstructive pulmonary disease. Surgical options are available as well. These procedures aim to remove or reduce airway blockages caused by excess tissue or anatomical issues. Common surgeries include uvulopalato-pharyngoplasty and nasal surgeries. Surgery is usually considered when other treatments do not work. Lastly, there are emerging and experimental therapies. Research is ongoing into methods like continuous negative external pressure and oral pressure therapy. Devices that stimulate the upper airway, like Inspire therapy, are also being evaluated but requiring a specialist's assessment. When it comes to treating sleep apnea in people with chronic obstructive pulmonary disease, it is essential to choose the right method. Bilevel positive airway pressure is often recommended because it supports ventilation better and eases the work of breathing. Always consult a healthcare provider to find the best option for your specific needs.